Okay, we're back. I'm going to go ahead and pre-soak this number 10. I'm just barely putting in. And let me know if you feel like anything is different or you're tasting something differently, okay? Because I'm using a chemical that could irritate the tissue a little bit. So we'll rinse it out of there. I'm just trying to get this. It's called tartar and stain remover. I'm just going to put that in there, let it pre-soak, and I'll work on the other screws. So again, I'm just going to hand this one. I'm going to pre-soak as well. I just don't trust all the debris that might be in there. And might as well here. So all of them pretty much show some wear and tear from the driver itself. Some of them are a little more worn than others, so I have to be very careful with these. They were all actually tightened to 15 centimeters, Newton centimeters, which is a little more than hand tightening. At 15, you have to take a wrench and do that. Probably would behoove us to basically hand tighten these and I think it depends on the individual. With me, I know mine hand tightening is pretty close to 15 just with hand alone. So all right, pre-soaking, and we'll start to remove the screws. I'm going to use a wax tip called a pickup stick, and they look like little Q-tips. Pick and stick, excuse me, and this is what it looks like. So that would be easy to manipulate if I had to remove. And the order is not necessary in order because all the screws are identical. The driver that I'm going to use too is a Nobel driver. I'm just vacuuming out that chemical, getting it out of there. This is a blunt end 20 gauge suction device, and blunt so it doesn't cause any changes to occur in the metal. I'm going to rinse all that out. Actually, with a cleansing material from Ultradent, go ahead and do that. So it's like a soap. And then we go to the next one. And then the next. So this is all my protocol that I follow. I want to make sure that we don't add to the problem. And it's as simple as the detail related to each screw. You know. Because as you undo a screw, where's the material going to go? It may go down inside the threads. So you want to make sure at least the top of it's cleaned. Okay, so now they're all cleaned. Next step, I'm going to take a driver. We're going to put the fishnet in next. I call it a fishnet. It's actually a 2x2 gauze. I'm going to take my regular driver. And hopefully this will come out with just hand undoing it with my hand, hopefully. So we'll start off with the left side here. It's a problem side. Alright, so we'll just got it in there like that. That's all the way in, and then just go left. Alright, so that one came. I shouldn't say easily, it took a little bit of doing, but definitely. There's the other one, alright. And no problem. And it did feel like they were holding. So let's try this one now. Perfect. Okay, so they all felt good. That's good. That's a good note. All right. So let's get a feel for tightening. What's that like? All right. So hand tighten again. Get that in place like that. Hand tighten. No problem there. No problem there. Everything's good. And final tightening. It's just a matter of finding the perfect. Okay. So all four, in my mind, at least to the feel of the threads, feels good. All right. Now we've got to get this repaired. So let's check the bite next. We're going to do, first of all, check with a horseshoe paper, which has got blue on one side, red on the other. We're going to go tap in blue first. So I'm going to ask you to just go ahead and just tap, tap, tap your teeth. Okay. Very good. And great. Let's have you squeeze together. Squeeze all the way together. Right. Open. Okay, so I'm looking at a little heavy here in the front with the occlusion. Right. Let's see if we can pick up any more marks. Bite down all the way. Stay closed. So there's nothing on the right side. Open. And close and stay closed. Oh, open, close, and squeeze and hold. So there's nothing on the left. So here we go. Bite down. It's all right here in the front. Okay. So we know we've got to adjust one of two things, either the lowers or the behind the upper anteriors. So we've got a little occlusal problem. Can we do it all just by adjusting teeth, or do we need to add material? Sometimes you add a little bit of composite to the back molars to give back the bite. You need it more even. Bite down together. So we may end up doing that. I'll have the lab, or we can do that maybe in the laboratory. Just add a little bit of composite or acrylic. All right, a lot of discoveries going on here. So next steps are important. We're going to take the denture base out, clean it, and then reposition it and put it back in place, and then lute it together and then take it out. But we want to look at the threads as well. Let's play a safe game. Let's lute it together and take it all out as one piece. And we can always separate. Just put a little bit of material in between. It could even be a bonded material, just to lute it together. Let's play a safe game before we do anything. You never know. We can do it with a blue material. That's fine. Okay. So step one, I'm going to actually prepare a little trough, if you will, in between the fractured. It's kind of like a bridge that goes from one end of the fracture over to the other, like bridging over a body of water. We'll do it with the same 330 burr. And we're going to go in the thickest portion of the denture, assuming that there's no tissue right below us, and more than likely there's none, but I'll still go as slow as I can go. A suction, please. So here we go. This is just a small little trough area. And we're going to use a blue color so we can remove it at any time and know exactly we removed it all. Very good. It's pretty strong material. It should hold everything in place. And I might go just a little bit further. All right. Okay, good. Now we just got to rinse everything thoroughly off. I'm going to lower my light. This is fully light curable, so once it's in position, we'll cure it. No, I won't have to worry about the shaft, and that's going to be fine. I'm just going to make sure it's dry. Oh, this is fine. I got it all right here. Here's the scope. So occlusion is a factor here. That's one thing. We can work on that. Okay. Alrighty. Let's just lute it together. All right. Just give it 20 seconds of curing time and we should be in good shape. Now, because these are excuse me, they're non-engaging. What non-engaging means that if part of the denture base comes loose, it will rotate because there's nothing preventing it. There's no hex, so nothing is rotating it. Here comes that fishnet again. All right. Again, my light's going to go back up. Well, you're going to use lowest power, 3.5 power right now. And we'll also have our pick and stick ready and any pliers that have to be ready to pick anything up. Alrighty. And uppers are different than lowers. Lowers you don't have to worry, gravity carries everything. So one screw out at a time probably be the most appropriate measure. There it is. It's staying quietly. That's good. Let's get that out with the pick and stick. It comes quietly. Sometimes you have to form the wax to a point to go in and get the head of the screw. Oh, blocking the view. Hold on. Here it comes. There's one. So that's going to go in peroxide for now. So we have a little dish. Every room has a little dish marked beautifully by my dental assistant. And she's going to put a little bit of peroxide right in there. Perfect. Okay. One out. 3 to go. I've already informed too the patient that sometimes there's material that gets caught underneath that it's hard to get even with a water pick. So it's good to hear that he is using a water pick. All right. Actually, I'm going to do this one last because it's the strongest one. I'm going to go in here and get these other two out. Let's do this one next. All right. Let's see if it comes straight out. Yeah, it's doing the same. It's doing the polka in there, or whatever dance it wants to do. Wants to stay in there. The hide and seek. That's a better way to look at it. Okay. Oh, come on. There it comes. We got that one. That goes into peroxide, and now we've got one more in the back. And then we have the last one. So here we go. See, now that, to me, that's a very passive fit. All right. And you can kind of hear and feel a little click, and that usually means that it's now the threads are all the way. That's a long one to get out of there. Let's see, that one may not be able to get out. So once you have the suction, go right up underneath it. Actually, a suction tip would be fine, just a regular suction tip. We'll use the small micro suction tip in there. I think there was one time we had to go to a larger gauge. So let's see if the 20 gauge does it. If not, we'll go to a larger orange gauge. It's coming. Let's see. I think the larger gauge would be perfect. So the orange. So this is 20. We're going to go to like an 18 gauge. I'm going to put my finger there so nothing falls out, and then you can rest your jaw while I'm holding. All right. I'll be right back to pick this up again.